G'day people, this is from an official website from the New South Wales government. It's from the Sydney Children's Hospitals Network. I'll provide a link down below. Now it says here, stuttering. Stuttering is a disorder that affects the flow of speech. Okay. Introduction. Stuttering is a speech disorder that makes it hard to speak smoothly. Well, I would agree with that. Children who stutter know what they want to say but have difficulty saying it clearly. This is 100% true. When I went to school, so some teachers were actually a bit frustrated at me when I couldn't answer a proper question. Stuttering usually begins in childhood between the ages of 2 and 5. Well, I haven't actually looked up the official statistics on this one. However, between 2 and 5 is generally when children start to talk anyway. This is when children are learning to put words together into short sentences. I am definitely not a pediatrician. And if there's any pediatricians watching this, you can comment on this one. But my view is 100% true. Stuttering can develop suddenly or slowly and can be more common in boys during early childhood. There's two things to unpack here. The first one is it says that stuttering can develop suddenly or slowly or slowly. I think that my stuttering came on quickly. And there are times when you can have a stroke and then suddenly start stuttering. Can it come on slowly? I do not know the answer to that question. And it is more common in boys than girls. So they got that one 100% correct. Around 1 in 100 people stutter, and it can affect people of all languages. I think they meant to say 1 in 100 adults. When it comes to children, a lot more children stutter than adults do. I read somewhere that that the stuttering rate in children could be as high as 8%, and it says it can affect people of all languages. Well, I 100% agree on this one. It doesn't matter what language you speak, you can stutter too. Signs and symptoms. Signs and symptoms of stuttering can include repetition, repeating sounds, words or phrases. I can do it. This one seems to partly remind me of Porky Pig. Not the Porky Pig that you see on the screen, but when it comes to the comics, it seems to be the I. Prolongation, stretching out sound. Where's my sister? I don't think I've done much prolongation. If you've known me for a long time, have I done that? Okay. Yeah. Blocking, getting stuck on words where no sound comes out. This is quite common. And yes, I have blocked many times. For example, I might say, I am going to the, and then not say anything after that. When I was trying to say, I am going to the shop. Physical movements, face or body movements, like blinking, head jerking, or unusual facial expressions when trying to speak. I don't do many physical movements myself. However, I have seen many people who stutter do just that. An example is I am trying to see the train. Stuttering can vary in how severe it is, depending on the situation, environment, or time of day. I don't know what to say about that one. It may be more noticeable when your child is anxious or nervous, stressed or excited, tired or arguing, not giving enough time to speak, using complicated language, competing to be heard. All of this is true. Now, I have, with the last one, it says competing to be heard. This sort of thing does happen often. An example of this would be you've got several children, and one of them says, and you say to them, "Okay, I've got this piece of cake here. who who, who wants the piece of cake? The child with the with the stutter wants the piece of cake, but can't say that they want that piece of cake. So eventually you give it to someone else. Some children stuttering improves when they sing, whisper, read aloud with someone. Uh, Now, the jury is still out when it comes to singing. However, if they want to try singing, then go ahead with it. When I was young, I I had several people telling me that I should try singing. I don't think that they would have wanted me to stand outside their bathroom window and sing, but anyway, whisper. Um, I I haven't actually heard of this one, but maybe someone can fill me in on this. Read aloud with someone. I have tried reading aloud, and well, 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 my experience is no difference. If you're concerned about your child's speech, talk to your local doctor or child and family health nurse, or contact a speech pathologist for further help. Getting help for stuttering as early as possible is important because it can be harder to treat as children get older. A speech pathologist will assess your child's speech and ask if anyone in your family has a stutter. Stuttering is graded based on how much your child's speech is affected. The speech pathologist will count the number of stuttered syllables and compare it to the total number of syllables your child speaks. A syllable is one unit of sound in a word. For example, pull has 2 syllables. If you're worried about your child's speech, the only person that you should speak to, apart from a trained doctor, is a speech pathologist. I can't emphasize this one enough. Seriously, only, I'll say that again, only listen to a speech pathologist. Stuttering is usually classified as mild, less than 5% of syllables stuttered. Mild to moderate, 5 to 10% of syllables stuttered. Moderate, 10 to 15% of syllables stuttered. Moderate to severe, 15 to 20% of syllables stuttered. Severe, more than 20% of syllables stuttered. Mm. you should speak to your speech pathologist about that one. Treatment. The type of treatment your child needs depends on their age and how severe their stutter is. Treatment generally focuses on helping your child speak more clearly and comfortably. It's hard to know which children will outgrow stuttering, so it's important to get help early. My view, if you're the parent or guardian of, of a child that stutters, you should do something about it straight away. Younger children. The best treatment for preschool age children who stutter is the Nikon program. This is a behavioural program where parents and carers are trained to help treat the stutter at home. Children attend therapy once a week and practice speech tasks at home with their parents or carers. Parents and carers are taught how to give helpful feedback and track the stuttering. Well, I can't make any comments on the Lidcombe program because I just don't know that much about it. And then older children. For older children who stutter, speech pathology treatment may focus on things like breathing techniques to help produce sounds more slowly with less anxiety. One thing that's taught is you are taught um, breathing techniques such as, and then you start talking. Controlling and monitoring speech to improve speech flow. Unfortunately, this just often means talking slowly. Practicing speech in different situations and different language levels. An example of this would be you might pick up the phone and ask someone if they sell something, or you might go to a supermarket and ask someone, do you have this particular thing in stock? And a speech therapist would stand maybe 2 meters away and to listen to what you did. Education, to help your child and family understand what is happening, why it is happening, and how your child may be affected in other areas. My view is on this, I'm not quite sure that having family members involved in any stuttering treatment is a good idea. The reason for this is they might think that you particular want this particular way of talking, when in fact you don't want it at all. Managing anxiety and stress related to stuttering. I could go on and on and on about stress, but I'm not going to. School support. Well, well, to be fair to schools, they they normally don't know how to deal with with students who stutter. Speech and language assessments to understand which areas need support, like language understanding, pronunciation, social skills, attention, and communication. This all sounds good in theory. However, this is all due to stuttering, so I'm not quite sure why they added that one. Management. Causes of stuttering. The exact cause of stuttering is not fully understood, but it may be linked to how the brain controls speech. Some facts about stuttering include: stuttering is not caused by anxiety, low intelligence, or parenting styles. There's a lot to unpack here. No, it is not caused by anxiety or low intelligence. Look at how many smart people stutter. And if you're the parent of a guardian who of a child who stutters, don't worry, it's not your fault. Stress or excitement can make stuttering worse, but do not cause it to develop. I think that maybe when a child is stressed, they're more likely to stutter because that they don't think about what they're going to be saying. Boys are more likely to stutter. Yeah, yep, that's true. Stuttering cannot be learned or caught from others. Yes, they had to put that one in. Supporting your child at home. Positive support can help build your child's confidence and make therapy more effective. Below are some helpful tips for supporting your child at home. Let your child finish. Give them time to speak without interrupting or finishing their sentences. One thing that you need to bear in mind is that your child will not be able to talk as fast as most other children are. Focus on what they are saying. Listen to the content of their message, not just how they say it. This shows you value their thoughts and understood what they are communicating. I would also like to point out that don't guess on what they are saying. Create a calm environment. Minimize distractions when your child is speaking. This helps them feel less rush and more confident. a calm environment. What if the parent or guardian is saying, right, 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 okay, you get over, go do that, go do that right now. Be patient and understanding. Stay calm and patient if your child struggles with speech. Don't show frustration or upset. Remember, the children who stutter aren't doing it on purpose. Avoid giving advice that could increase anxiety. Comments like slow down or take a breath can make your child feel more self-conscious. Instead, reassure them that it's okay to stutter and that you're listening. I've had things like, "Oh, come on, spit it out," as if that's going to make me stutter less. Speak to your child normally. Keep your speech natural. Avoid slowing down or changing how you talk. Don't criticize or tease your child about their stutter. Offer positive reinforcement and focus on the message, not the stutter. Uh, I don't know what to say about that one. Protect your child from others commenting on or trying to fix their speech. Avoiding unwanted attention or correction can help build your child's confidence and self-esteem. Well, now to my final thoughts on this. If you're the parent or guardian of a child that stutters, yes, you do need to do something about it. But don't make a massive fuss about it. You don't have to constantly tell them to use any technique that they may have learned. And you are going to hear things like, "Oh, well, we had this guy and he did this and he didn't stutter anymore." Forget it. It doesn't work. And finally, what do you think about this? Let me know in the comments.